So what's your name?
Kathy Stafford.
Okay, and how long have you had dry eye?
I had an instance of it back in my late 20s, early 30s, after many years of contacts and using Accutane for acne. So I, at some point, stopped wearing contacts, and it seemed to go away. I thought I could live with that. And then last year in April, I had LASIK. My husband went in, and I went in. He had cataract surgery. I had LASIK. And immediately that same day, I thought something's wrong here. I'm in big trouble. What happened?
Right. What were your symptoms?
Just terrible dry eye, sandiness, vision wasn't as good. And they had talked about going to a movie right after LASIK and staying awake for the day. And I thought, how can anybody do that? I am in total misery. And I didn't know if something with the surgery had gone wrong or if it was my dry eye or what. And it took a few days to know that this wasn't right. And so I continued to go back to the doctor on my regular checkups, and they would talk about, you know, I was having dry eye. So we tried different medicines, over the counter.
Different drops.
Different drops.
Okay.
And finally, let's see, I'm on my third treatment. Probably in the middle of this winter, they started talking about using plugs on me, trying a plug of some sort.
Okay.
And I was worried that that was just a temporary solution. And it was pretty severe for me. And my family was really upset that I had had this so badly. And I was dropping eye drops constantly.
Were they helping or just masking the problem?
Just temporarily helping me feel better, but it wasn't fixing anything.
It wasn't fixing anything. So it was really impacting your life.
It was. It was. And I told the doctors, within a month or two, I said, I drive probably 36,000 miles a year, and I'm actually scared to be driving. I'm not seeing as well, and I'm stopping at lights, putting drops in, and I'm waiting to get to the next light. And it was that bad. So I started doing my own research, and I found that there was a website dedicated to dry eyes, and then I had started to see some articles about IPL. Saw a couple of news stories on the TV and thought, I've got to do some research on this.
Right. And then you're on your third treatment now?
Third treatment today.
Third today?
I'm going to have my third today.
Oh, you're going to? Okay. And when did you start to notice it was helping?
Immediately.
Immediately.
The very first day I came in, I could see better. I had moistness in my eyes. Didn't feel like I needed to drop probably the rest of the day. In fact, I went almost 6 days without having to put any drops in whatsoever. And then after except for the prescription that Dr. Toyos recommended. And so I went 6 days, and I thought, well, that was really good. And so I knew it was starting to make a big impact and difference in my life. And so came back the second time, and it gets better again.
Good.
And now I'm just using a few over-the-counter drops as needed. I'm talking just a few. I'm lucky if I do 5 a day, if that, and I'm not even into my third treatment yet.
Great. So how has this impacted your life?
I feel so much better. Feels so much better. I don't have the discomfort. I don't worry about how I'm going to wake up in the morning or my eyes going to be shut with pain and agony. I don't worry about what I need to put in at night before I go to bed, and do I have them in my pocket to use as I need to. It's nothing like it was, so I'm so glad.
That's excellent.
Yeah.
Good.
Yeah.
Glad to hear that.
Yeah. I'm glad Dr. Toyos and others have researched and done this procedure, because people don't realize how bad dry eye is. You know, you tell them you have dry eye, and it's like, okay, that's nothing. It's like, no, it's really something, and you don't know.
It's simple, but it's really complicated.
It's very painful, and there really is no relief anywhere else that I've found, and so I'm just so glad to have found Dr. Toyos.
Yeah, I agree. I agree.